Today I would like to share with you on a topic that is sensitive and not often discussed among men: venous leak erectile dysfunction. This is a condition that affects up to 80% of men with erectile dysfunction and can be very troubling physically and socially as well as psychologically. Now, what is venous leak erectile dysfunction? For a man to attain an erection, it has to depend on good arterial inflow into the penis and a reduced outflow from the penis during the period of erection. And post-intercourse, after a climax, the veins then dilate and the arteries then constrict and blood then increases out increasingly to reduce the erection. In venous leak erectile dysfunction, what happens is the arteries are still flowing in, but the veins that drain are not able to constrict very well. In fact, are dilated and leak out pretty fast. The patient is unable to sustain an erection for long. Now, this problem is apparently responsible for up to 80% of erectile dysfunction cases and can affect young men as well as old men. Diagnosis is usually made preoperatively by doing a penile ultrasound, where we compare the ratio of the artery flow as well as the ratio of the venous leak. Traditionally, treatment has involved the taking of erectile dysfunction drugs such as Viagra and Cialis. This can help to some degree, but it does not stop the venous leak in the long run, and patients may find it decreasing efficacy over time. Other more traditional methods will involve the use of penile implants, in which implants to cause erection are inserted into the penis in a major surgical procedure. Again, this option may not be very appealing for young patients because it can be painful and artificial in nature. What we have pioneered is a procedure called venous leak erectile dysfunction embolization. Through a small vein, we make a puncture and then we do an angiogram and we check for the leaking points of the veins in the pelvis. Once we find these leaking points from the penis into the pelvis, we block these veins with a series of coils or glue such that the venous outflow is reduced significantly. As a result, blood flowing in normally and the venous outflow that was leaking excessively is now stopped and in fact reduced, and so an erection is then returned and maintained. This procedure is minimally invasive. Patients do it in the morning as a day case and they go home by the afternoon. And results are seen as early as 24 to 48 hours post and up to within a week. And patients can return to their activities, including sexual function, in as little as 1 week with effective results. So far in our series of patients, we have seen very good results with many patients happy, and many patients have been able to wean off taking erectile dysfunction drugs or avoid surgery.